Hi, my name is Ronan. I'm one of the Obs and Gynae Registrars at the Rotunda, and I'm also one of the RCSI clinical tutors. The anomaly scan, or the big scan, usually happens at between 18 and 22 weeks of pregnancy. We are checking to see that the baby is developing normally by looking at their anatomy. So when you come for your scan, you can bring someone with you, but we do ask that children don't attend for the scan. You'll be asked to lie down on a bed and to adjust your clothes to uncover your bump. The person doing your scan will put some gel onto your tummy and press on the tummy with a probe and look at baby from lots of different angles. In order for the person doing the scan to be able to see baby very clearly, they'll have to have the lights in the room very dim. You are asked not to take videos or photos during the time of the scan. The person scanning does need to concentrate while they're doing the scan, so if they're quiet or they're not talking during the scan, don't panic, this can be normal. The anatomy scan typically takes about 30 minutes to do, and you do not need to fast for the scan. We don't need you to have a full bladder for the scan like you would have had at your booking visit, but sometimes we might ask you to fill your bladder. The main purpose of doing the anatomy scan is to check your baby's anatomy to make sure that they're developing normally. We look at important organs like the brain, the heart, and the kidneys at the anatomy scan. We also look at structures like the baby's limbs, their spine, and also their face as well. Other things we look at during the anatomy scan are how baby is growing, the fluid around baby, and also the location of the placenta. For most people, when they attend for the anatomy scan, it's a really good chance for them to see baby more clearly, to get lots of nice pictures, and also to find out if they're having a boy or a girl. However, sometimes problems can be picked up at the anatomy scan as well. The anatomy scan looks at how baby is forming in the womb. We look in detail at organs such as the baby's brain and their heart and their kidneys. Some problems can be picked up antenatally on ultrasound. For example, conditions like spina bifida are commonly found on an antenatal ultrasound. So an ultrasound on its own can't diagnose a genetic condition. However, some genetic problems like Edwards syndrome or Down syndrome can be associated with commonly seen features on ultrasound. However, some of these pregnancies won't have any ultrasound features at all. If a problem is suspected, you'll be referred to a consultant fetal medicine specialist for further scans and further testing. The anatomy scan is a very reliable and safe screening test in pregnancy. However, no medical test is 100% perfect. Some factors such as the position of baby in the womb or the amount of fluid around baby or maternal body weight can impact on how clear of an image is obtained at the scan. There are some conditions that are not visible antenatally before baby is born or which may develop later on in pregnancy. One of the factors in getting nice clear images of your baby is the way that they are lying in your womb. So for example, if the baby is lying facing in towards your back, their spine is at the front of the picture that we need. This sometimes can mean that we don't get clear pictures of, for example, the baby's heart, and you might need to either go for a walk around and come back in a few minutes or come back another day to have another scan done. This is really important to make sure that we complete the anatomy scan and get all the images we need. However, it can be disappointing and frustrating for people to not get their full scan done in one day. Unfortunately, there's nothing that you can do to get your baby into a good position. Baby's position is decided by them. If everything looks good at your anatomy scan, the number of scans you have after that depends on a few factors. For example, if later in the pregnancy there's any concerns about how baby is growing, you will be referred for further scans. Some conditions affecting pregnancy, like preeclampsia or gestational diabetes, also will usually require follow-up scans later in the pregnancy too. If you're attending for midwifery care, usually no further scans are needed. If you're attending for hospital-based care, the doctor you see in the clinic will usually do a scan to check baby's position and to check their heartbeat. In general, we only do further scans where they're clinically indicated. So while you're having your anatomy scan, the person doing it will need to put some pressure onto your tummy with the ultrasound probe This can be uncomfortable for people, particularly if your bladder is full, but it shouldn't be painful. So if after your anatomy scan you're having any symptoms, please let your healthcare professional know.
Hi, I am Fiona Cody and I am a specialist sonographer in obstetrics and gynaecology. Why are internal scans not used as much in Ireland, especially on technically difficult mums? The answer is internal scans or transvaginal scans are used in Ireland routinely and in the Rotunda Hospital. So in early pregnancy, under 9 weeks, it is best practice, and many people will have had in the emergency unit, in our early pregnancy unit, or even at their first trimester scan, will have had an internal scan. We also use internal scans to look later on in pregnancy for placental localization. We also may need to do internal scans for measuring the cervical length for, different complications in pregnancy. And in ladies, as you said, with technical difficulties, with a higher body mass index, scanning certainly is more difficult, transabdominally, so looking on top of the tummy. So we do use transvaginal scanning where appropriate in these situations also. Yes, the cord is scanned several times during your pregnancy. Firstly, at the first trimester scan, we look at the cord insertion site into the placenta to see is it centrally located in the placenta, which bodes well for growth later on. If it's located at the edge of the placenta, this is called a marginal cord or velamentous cord, which is actually away from the placenta, then it flags us to alert us to request a growth scan later on in the third trimester in pregnancy to ensure the fetal circulation, the placental blood flow to the baby is good. At the anatomy scan, we also look at the cord insertion site into the baby. We need to check that there are 3 vessels in the cord, 2 arteries and a vein. We also need to check the cord insertion site again into the placenta. We check for cord cysts or any other complications of the cord. And also in late gestation, in babies with growth restriction, we monitor the blood flow in the cord, and this is called an umbilical artery Doppler. So where we are concerned that the fetal growth restriction is due to placental insufficiency or the cord blood flow being restricted in some way, we monitor this very carefully, sometimes twice every week, along with the baby's growth every 2 weeks.